Shoemaker, and I'm going to be doing the head-to-toe assessment on my patient, Miss Shoemaker here. So I've just washed my hands and I've gathered my supplies. I've also measured her temperature, pulse, respiratory rate, blood pressure, height, weight, calculated her BMI, measured her O2 sat, and her pain rating. The first thing I'm going to do is observe her overall skin color, appearance, and hygiene. And she is tan. I'm also going to observe her body stature and nourishment, and she is well nourished. I'm observing her gait, her position, her mobility, and she has steady gait. She ambulates unaided. She can hear, speak, comprehend, and follow simple instructions. Her speech, articulation, and voice quality is appropriate. Her native language is English. She is alert and oriented ×3 to person, place, and time. And her appearance and behavior is appropriate, and her mood is pleasant. So the first thing I'm going to do is inspect her scalp for contour, tenderness, symmetry, and deformities. And so I'm just looking to make sure that all her skin is intact and that I don't see any lesions or anything like that. And is any of that tender? I'm also inspecting her hair for color, texture, hair distribution, and cleanliness. And her hair is blonde, it's clean, she has normal hair distribution, and smooth texture. I'm going to inspect her facial features for symmetry and weakness, and her features are symmetric. I'm going to inspect her skin surfaces for characteristics and color, and she is a normal tan color. And I'm going to palpate the bony prominences of her face for tenderness, size, and shape. Is any of that tender? I'm going to inspect her, palpate her temporal pulse, and it is a regular 2+. I'm going to assess her temporal mandibular joint for range of motion, crepitus, and tenderness. Can you open your mouth and close? And was that tender at all? And can you clench your teeth? And that is assessing her masseters. Can you smile? Can you frown? Can you puff out your cheeks? Raise your eyebrows? And close your eyes really tight. Okay. I'm also going to palpate for temperature, moisture, texture, and tenderness. And she is warm throughout. The next thing I'm going to do is inspect her eyes. And can you cover your left eye and read this first line?
No, that's too little, I think. Offering 3 shades in a face palette.
And can you do it with your right eye?
Off 3 in 1 shades in a face palette. It's okay. That's really small though. Okay. It's okay.
Mom.
It's okay.
In both eyes.
3 in 1 shades in 1 face palette.
Okay. I'm going to inspect her eyebrows and eyelash for color, hair distribution, and symmetry. And they are symmetric. She has normal hair distribution. I'm also going to inspect her eyelids for closure, blinking, position, alignment, skin color, and symmetry. And they close normally. She blinks regularly. I'm going to inspect her sclera and conjunctiva for clarity and lesions. And her sclera is clear and white, and her conjunctiva is moist and pink. I'm going to inspect her cornea for clarity and lesions. And her cornea is clear with no lesions. I'm going to inspect her iris for shape and color, and her eyes are blue. I'm going to assess her corneal light reflex, and it is present and symmetric. Her direct pupillary response, shine this light in her eye, and her pupil got smaller. Accommodation, shine it in the same eye, and look at the opposite pupil, and it got smaller. Can you look at my pen light and look at the wall? And her pupils adjusted to accommodate letting more light in. I'm gonna check the symmetry of her eye movements. Can you follow my pen light? Alright. And I'm gonna check her peripheral vision using confrontation. So can you cover your left eye? Can you see that? Okay, and the same with the other. Alright. Next thing I'm going to do is inspect her ears bilaterally for position, alignment, size, shape, skin intactness, color, and symmetry. Her ears are symmetric, they're normal size. I'm going to palpate her ears and her mastoid area for tenderness or irregularities. You know that tender? I'm going to inspect her external auditory canal for discharge and lesions. And I don't see any. And I'm going to assess her intact hearing using the whisper test.
Smile. Happy.
And her hearing is intact. Next thing I'm going to do is inspect her nose and nasal septum for symmetry. And her nose is symmetric. I'm going to inspect her nose for foreign bodies, patency, and discharge. And she doesn't have any discharge or foreign bodies. I'm going to palpate for tenderness, tender. And I'm going to inspect her internal layers for moisture, tissue color, swelling, and lesions. And she doesn't have any swelling, lesions, and some pink tissue color. And I'm going to assess patency. Can you occlude one nostril and breathe in? And do the same with the other. The next thing I'm going to do is inspect her lips, her buccal mucosa, and her gums for color, moisture, texture, and symmetry. Open your mouth. And they are pink in color and symmetric. I'm also going to inspect her teeth for number, color, position, alignment, cleanliness, and her teeth are white and they're clean. I'm going to inspect her oropharynx for odor, color, and lesions. And I don't smell anything. It's no normal color. I'm going to inspect her hard and soft palate and the surface characteristics and color, and they are pink. I'm also going to inspect her tongue for movement, symmetry, surface characteristics, and color. And her tongue is pink with normal, symmetric, and no abnormal surface characteristics. Can you puff out your cheeks with your tongue? Can you stick your tongue out and move it left and right? Alright. The next thing I'm going to do is inspect her neck for symmetry, and I'm also looking at the skin characteristics and color, and she's a normal color. Her neck is symmetric. I'm going to palpate her trachea for position, lesions, and deformity. And her trachea is midline. I'm gonna inspect her shoulders for movement, and lesions. And I'm gonna, can you shrug your shoulders? And I'm gonna test her muscle resistance. And she has a 5+. I'm going to palpate her thyroid for gross and visual enlargements, and her thyroid is not enlarged. I'm going to palpate her carotid pulse. And it is a regular 2+. I'm also going to palpate the bony structures, her clavicle, her sternum, and her rib cage for tenderness or bulges. Is any of that tender? And I'm going to auscultate her breath sounds. Breathe in. Breathe in. And she has normal breath sounds. I didn't hear any adventitious sounds or anything like that. And I'm going to palpate her apical pulse. And it is present and 2+. The next thing I'm going to do is inspect her arms, wrists, and hands for skin characteristics and color. And they are normal color. No abnormal characteristics, lesions, or anything like that. I'm also going to inspect for symmetry, limitations in mobility, and deformities. And her hands and arms are symmetric. I'm going to inspect her nails for shape, contour, consistency, color, thickness, and cleanliness. And her nails are all the same shape. They are clean. I'm going to assess her capillary refill. And she has a capillary refill of less than 3 seconds. I'm gonna palpate for edema, no edema, and skin turgor. And she has normal skin turgor. Next thing I'm gonna do is inspect her interior chest for appearance, color, configuration, and symmetry. Her interior chest is symmetric. It's normal color. I'm going to listen to her heart sounds. With the diaphragm first. And then also with the bell. And she has normal heart sounds, they are regular rate and rhythm. And I'm also noticing her pattern and effort of breathing, and her breathing is effortless. I'm looking for any retractions, sighing, paradoxical movements, lifts, heaves, thrills, or pulsations, and I don't see anything like that. I'm also going to inspect her posterior chest for color, configuration, appearance, and symmetry, and her posterior chest is symmetric. I'm also looking at her pattern and effort of breathing, and same thing, her breathing is effortless. And I'm going to listen to her breath sounds. Breathe in. In. And I'm going to listen to 3 points on the left. Breathe in. Breathe in. And 4 points on the right. Breathe in. And breathe out. And she has normal breath sounds. And at this time, I'm going to get you to stand up and bend over for me. And I'm going to palpate her spine for any curvature or bulges. And you can stand back up. And I don't feel any. Her spine is straight. I'm also going to palpate her ribs from the back, her scapulae, and her spinous process. Is any of that tuned in?
No.
Alright. The next thing I'm going to do is have you lay on the bed for me for the abdominal. And and at first I'm gonna inspect her stomach from the side for size, shape, movement, and note any peristalsis or pulsations. And her stomach is a little round, and I don't see any pulsations or peristalsis. I'm also observing for lesions, scars, vascularity, and irregularities. And I don't see any scars or lesions or bulges or anything like that. I'm going to auscultate her vowel sounds. And she has normal vowel sounds, and I'm also going to use the bell to listen for any bruits in her epigastric area. And I don't hear any bruits. And I'm going to palpate in each quadrant for tenderness or irregularities. Is any of that tender? Alright. And if you can get back in the chair for it. And next, I'm going to inspect her. I'm going to do passive range of motion. And I'm going to just take your arm around. Now, I didn't hear any crepitus or anything like that. Is that tender at all? I'm going to do it the same over here. Any of that tender? I didn't hear any crepitus. I'm going to test her muscle strength. You'll hold your arms like this and push up against me and pull and squeeze my fingers. And she has a 5+ muscle strength. And I'm also going to get you to do that yourself. So take your shoulders around, your elbows, and then your wrist. And I'm going to inspect her legs, her feet, and I'm going to first palpate her brachial pulses. And they are regular 2+ and her radial pulses. And they are regular 2+ as well. And then I'm going to inspect her legs, her feet, and ankles for surface characteristics, for symmetry, deformities, and limitations in mobility. And she has normal skin color, her legs are symmetric. I'm going to inspect her toenails for shape, color, consistency, contour, thickness, and cleanliness. And her nails are clean. They are all normal shape. They're not too thick. I'm going to palpate for edema. And she has no edema. I'm going to inspect her capillary refill. And she has normal capillary refill of less than 3 seconds. I'm going to inspect her heels for skin intactness and lesions. And her skin is intact and she doesn't have any lesions. I'm going to palpate for temperature, texture, moisture, and tenderness. And she is warm throughout. And I'm going to do passive range of motion. And you can push against my arms push on my hands and pull up. She has normal 5+ muscle resistance. I am gonna palpate some lymph nodes that I just thought about. Her occipital lymph nodes, her preauricular, her postauricular, her submandibular, sublingual, and submental. And they are non-palpable. Was any of that tender? Non-tender. I'm gonna palpate her I'm also gonna, can you swallow? And I'm gonna look at, open your mouth and say ah. And I'm looking at her uvula and pillar movements, and they are normal. And I'm not gonna elicit the gag reflex, but normally I would do that as well. And I'm gonna palpate her posterior tibialis pulse. And they are regular 2+, and also her dorsalis pedis pulses. And they are regular 2+ as well.